Hi, and thank you for joining us for another episode of We Are In This Together, the show that we've been doing almost every week since the beginning of COVID-19, telling stories of the work of the Red Cross and telling advice and giving ideas on how to stay safe and healthy during this really uncertain time. I'm Angela. I've been the host since the beginning, and usually we bring on a national society or an expert in health to speak a little bit about it. This week we have a different guest. This week I get the privilege of introducing you to our new host. Our new host is Teresa da Silva, and she is joining us. And so as I pass the baton, she will get to ask me some questions this week. So Teresa, I throw to you to start, but first maybe just tell us a little bit about yourself, and then we can get underway here.
All right. Thank you so much, Angela. So I'm Teresa da Silva, as Angela mentioned, and I'm the new communications officer for IFRC for the English-speaking and Dutch-speaking Caribbean islands. So I'll be taking over from Angela, which is a huge pair of shoes to fill. But she has been doing an excellent job, and I'll be continuing this each week. And so we're looking forward to sharing all the wonderful and exciting information about what's happening there in the field. All right. So I won't dwell any longer on me because I'll be with you for the next few weeks and months. But I'm so excited to hear from Angela what's happening. She's in Guyana this week, and right, Angela? And I'm excited to hear what's happening with your mission and what's happening in Guyana right now.
Sure. So I was really fortunate to be able to travel to Guyana to follow the work of the Guyana Red Cross as they work with communities really across the country and how to stay safe and healthy during this time. So we traveled to an area called Region 1. We traveled to a bit of a hub on a river that runs from almost the border of Venezuela all the way into the interior of Guyana. So what we did is we reached out and talked with community leaders along the river to find out where there was a real need to have messaging and information about COVID, as well as where there was a need for cleaning equipment. I mean, we were talking about communities that for us to get to, we had to fly in a small plane for about an hour and a half and then take a taxi bus to get to a boat, which then we had to travel up a river for about 20 minutes. No, further than that, maybe 35, 40 minutes. Upstream to get to some of these communities where people are not able to access some of the same information you would. There isn't Wi-Fi signal. There isn't a cell phone signal always out there, right? And so how do they get the good information? When we talk about good information, we're talking about trying to stay socially distant or physically distant, but still staying socially close. It's about wearing a mask that covers your nose and mouth. It's about having good hygiene practices. So washing your hands often, especially if you've been to talk to other people or visit with other people, and making sure that they have the supplies in which to do that. So as I said, we got to travel all the way up this river and meet some of the people in this community with the assistance of the community leaders. And it was so amazing to watch the relationship that the Guyana Red Cross has created with these communities. I mean, they see the Red Crosses come up in a boat because you have to reach, it's like every house has a driveway through the mangroves and the waterway up to the house where the family is, and they come out and, you know, we're staying distant, we're in the boat and they're on their land and we're talking back and forth and making sure that people know those basic facts, like I just mentioned, around the wearing the mask and the washing the hands, but also asking them if they have any questions. You know, some people really only heard that COVID-19 or coronavirus was a thing, and they knew it was a sickness, but they wanted to make sure they understood what the symptoms were or what they should do if they had the symptoms. And so it was a really good opportunity to remind people about calling a health center. And I think it's really important for people watching to know that before you feel sick, before someone in your family feels sick, know what to do if someone has symptoms of COVID. Know what to do in your country. Do you call the health center? Is there a place you're supposed to go? And have sort of a plan in place. So it was a really good opportunity to have these conversations. And as I said, the community members were really excited to see the Red Cross come and really excited to interact. Ouch, sorry, I'm dropping something here, with the Red Cross. So yeah, it's been really, really great.
Right. I can imagine. And I know Guyana has quite a number of COVID cases, right? In terms of the number of persons who have been infected, and they're also battling dengue cases as well. Can you tell us a bit more about that?
Yeah, so I don't have sort of concrete numbers, but
Mm-hmm.
there are more and more cases every day.
Mm-hmm.
Um, People who are sort of in these remote areas can be quite impacted. They live in very small, close, tight knit communities. So it doesn't take many cases for there to be many more cases.
Mm-hmm.
Um, we also see many cases amongst migrant communities because they live very close together. They don't always have the same access to services. So, like anything, the Guyana Red Cross is really focusing on vulnerable populations, people who need that support. You did mention dengue. Dengue is something that the country is seeing cases of in different areas. Also malaria. Things like dengue make it tricky during COVID-19, right? Because a fever, we always say if there's a fever and a cough, you might have COVID, but a fever is also a sign of dengue. So really making sure people understand what the symptoms are and understanding how important it is to get health care and how important it is to take care of themselves. So by extension, they take care of their families, right? Because, sometimes if you're not feeling well, you think, okay, I can just push through this, or it's just a little cough, or I'm just not really, I'm not really feeling that great. But it's really important that people aren't just stopping there. It's really important that if you really are unwell, to go and get that help. And so while they are talking about COVID, they're also answering questions about dengue. And a lot of the measures that go into preventing the spread of dengue are bits of information that the Guyana Red Cross has been sharing in many regions and in this area we were in previously there was a Zika project. So methods put in place to control mosquitoes, getting rid of garbage, making sure you empty water, any container that there could be water. So you don't store a bottle or a water barrel upright. You want to make sure you turn it upside down or that it's covered so mosquitoes can't lay eggs. Making sure that you're wearing repellent when possible. Screens on doors and windows. All of these steps people can take to protect themselves from a mosquito carrying Zika is the same tips and tricks that you use to prevent the continuation of mosquitoes that can carry dengue. So a lot of the same principles that were put in place during the Zika project are coming back to being used now during dengue, and that's been a really important step. And I spoke with one volunteer actually in the one community we were in, and he became very involved with the Zika project and with Red Cross. And he says he's now sort of known as the Red Cross guy in town. And when people see him, that's how they think of him. And people come to him to ask questions, whether it's about Zika or dengue or malaria or COVID-19, because these are all areas that the Guyana Red Cross has been involved with. A project or support or healthcare advice or information over the past number of years. Yeah.
And that example right there speaks to the power of the Red Cross in terms of being able to share useful information for people so that they can make informed decisions, especially as it relates to staying safe and healthy, right? And I'm sure you've had to apply a lot of these same information that you've been sharing with persons as well, because you're in the field, you're in the midst of it all. How do you protect yourself specifically in terms of ensuring that you don't expose yourself to all the many hazards that are out there?
Yeah. It really, like you said, it's the same advice, right? Whenever we leave our homes, whether we're going quite far afield, like we did traveling with Guyana Red Cross, or whether you're going to the grocery store in your own community, it's the same principles apply. I mean, you maybe don't wear mosquito repellent to your grocery store, but maybe if there's an area, you're in an area where there's a dengue outbreak, you might be, right? And so when we talk about how to go out into community or how to sort of continue to exist during these times, it's really those, we wear a mask everywhere, from the time I'm not wearing one right now because I'm talking to you and it's a bit funny to talk to you from behind a mask, but from the moment I wake up in the morning till the moment I go to bed, we're wearing masks, and that's not protecting me, that's protecting others from me, but it's also setting a good example, right? I'm wearing a mask to protect you, please do the same. So that's a really important piece. I wash my hands all the time. soap and water whenever it's available, and hand sanitizer the rest of the time. You know, every time I open a new door, or if I let someone borrow my pen, I wash my hands and then I wash my pen. And it might seem like overkill, but I know if I get ill or if anyone on this team gets ill, their ability to do their work is really impacted. And nobody wants that, right? So we're just really making sure that for every action we're taking, we're making sure that we have the pieces in place to protect ourselves, but also to protect the communities we're working with, right? We don't want to carry anything anywhere either. So like I said, we wear masks, often hand washing. We do keep physically distant. You know, historically, I'm a very close talker. I'm someone who might put my hand on your shoulder when we're talking. I don't do those things right now. And I have to think about it, right? You meet someone new, and what do you want to do? You like stick out your hand, or you go for a hug, and now you're kind of like maybe I'll do a distant foot bump, or maybe we can touch elbows. But even then, you know, you're really trying to keep that distance and have those conversations. And I think a big important part is when you are having those conversations and when you're modeling that behavior, you can help other people understand. We did 1 day of sensitization in the main town where we left from to reach some of the smaller areas. And we walked down the street, and basically every time we saw a group of people standing together talking, we took a moment to say like, hey, do you have a minute? We want to give you some information about how to stay safe and healthy. And also we have these masks. So if you're going to stand this close together, you should really think about wearing them. And so we went through this whole community area and shared this information and handed out masks. And by the time we came back through, almost everyone we talked to was wearing masks or, you know, engaging with the information we'd handed them. And I just think that's great, right? Because it means people do really care for their communities and themselves and their neighbors. And we need to build on that. I think that maybe answers the question. Oh, safe and healthy in the field. Yeah. So, you know, modeling that behavior helps support seeing it. And then that helps people support everyone else in their community.
Yes. And it's important as workers in the field, whether Red Cross staff or volunteers, as you mentioned, to model the positive behaviors. If we're wearing our masks, we have to ensure that we have it on over our nose and our mouth, not just, that's a big pet peeve of mine, to see persons wearing their mask above their nose, under their nose, right? So ensure that it's always covered, right? And see Angela showing us the correct way to put on your mask. And also remember as well the correct way to take it off. And she's demonstrating that as well. And you remember as well that if you're wearing your cloth mask, you do have to wash them. It's not just a case of wearing it and putting it down and then taking it up the next day and wearing it again, but you have to wash them. And we have an entire feature on this video, this channel rather, where you can go, and we did an entire feature on masks and how to take care of your mask and how to wear them properly. So you can be sure to check that out. Also remember that we have the chat available as well, and I see a couple comments in the chat. All right, so one person says we all need to be socially responsible. So yes, we actually do need to remember, and as Angela put it perfectly, when you wear your mask, you're not just protecting yourself, but you're protecting others. Think about those around you, those who you love, your loved ones, your family members, your friends, and even the person who you don't know, right? So it's always important to stay safe and healthy wherever you go. All right. So Angela, you have been with us. You're in Guyana now, but you have been within the Caribbean for quite a few months, right? How has that entire experience been? It's coming down to a close now, and I'm sure we are all going to miss you because you've been such a huge pillar of support for us. But tell us how the overall experience has been in the Caribbean, because you're from Canadian Red Cross and deployed as a delegate to the Caribbean over the last few months to assist with COVID-19. Tell us a bit more about that experience and working with the national societies within the Caribbean.
So I know, at the risk of getting all the rest of the national societies saying, hey, wait, I've worked with some of the greatest national societies. I really think that the energy and the power and the excitement that such small communities and such small islands have for supporting each other and for supporting communities has been really incredible. I mean, I first actually worked with Truvisa because we created a music video with the reggae artist Basie right at the beginning, when people were still really confused about what was going on, to make sure that we were trying to reduce stigma, right? Because it could look like you or it could look like me, as he would sing. And that was a really great piece to be involved with. We've seen all sorts of posters created reminding us to be physically distant but socially close, right? And having those tight-knit relationships with our friends and family are so important. So you're doing it by phone or by chat or by Facebook, or if you're really creative, maybe you're sending letters. And I think those kinds of messages and watching how national societies have been able to use those to reach communities has been really amazing. You know, Dominica Red Cross made a music video, which is perpetually stuck in my head about Dominica Red Cross. You know, we're going to stop the spread. We're going to get Corona dead. Like, just great ways of reaching communities. I feel like I'm going to miss people as I list by national society, but there was this really cool letter writing campaign in Suriname where volunteers wrote personalized letters that went in care packages to people who were physically distant and sort of more isolated in care homes. So the elderly were getting notes from real people with encouraging messages. I saw, like, in Antigua and Barbuda, they were really worried about food security and making sure that, like, people had the ability not only to get food through the Red Cross, but also by going through and being able to have, like, the foundation to look after themselves with plants and vegetables and the ability to garden. With Grenada, we saw lots of outreach through their local media and papers, and with Guyana, I mean, like I was saying, you know, they're taking boats up rivers to take information and messages. Barbados is doing incredible work around food security and delivering care packages. Same with St. Lucia, and involving their volunteers in a way and starting to do food vouchers. And we're seeing these things from, like, Bahamas to St. Kitts and Nevis. And, you know, I've been so fortunate to, I want to say I play a role. I mean, I'm here to support the work of these national societies. You're now here to support the work of these national societies. And they are the lifeblood of everything. And they are what's there to support their communities. And they're what's going to help get communities through COVID, whether it's through psychosocial support like we see in Jamaica, or whether it's, you know, the ongoing provision of meals on like we have in Bahamas. It's been such an incredible experience. And, you know, you said I'm usually from the Canadian Red Cross. It's been a lot warmer being involved with the Caribbean. Oh, and Trinidad and Tobago, I've got to tell you this. We spent a couple of afternoons all crammed into a car with a loudspeaker sharing messages around COVID-19. But the great part about that was, like, there's messaging where you, like, drive up and down and it just plays automatically. So you might catch parts of it, but you might not catch the whole thing. There was real people who were sharing the message. So more and more people could be reached and could have the opportunity to hear and receive messages and see the Red Cross and know that we're a great place to go for information. Because I think that's the really key message is in a time where there's so much confusion and so many different and conflicting opinions on COVID-19 and what's happening, a real take home is that the Red Cross is a safe place to go for information. We have information and we're a good place to go for it.
Yep, that is so true. And I actually see someone in the comments, they're asking, how do you guys feel about the Caribbean response to the virus compared to the rest of the world? And what unique challenges do we have pertaining to our culture? So, Angela, you have worked in the Canadian Red Cross and you've worked in the Caribbean. Would you care to share your feedback on that question? How do you see the Caribbean response, so to speak?
We can't really compare responses, right? Because as you point out in your question, Terry, there's different challenges and different needs and different responses to everything. So to be able to compare and say one is one way and one is another is really not possible to do. But what I can say is when I look at what the Red Cross is doing in the Caribbean, they're reaching out to communities. They're working to find out what kind of questions are out there, what kind of rumors are out there, and they're really trying to tailor their approach to be able to answer those questions, be able to provide the information people are looking for. And I think that's a really important step, right? Because then what you're doing is you are really working to meet your communities where they're at, instead of trying to just take like well, this is how you deal with Corona and jam it into a space. I think it's really important that you look at what your community needs. Maybe you start with the general message And then you go, okay, everyone knows this, but maybe they don't know that. So let's now share that information. Or maybe they don't know this, let's talk about that. Or maybe people need cleaning kits over here, whereas people over here actually need food support, right? So finding out what people in your community need, what people who are sort of in the most hard to reach places need. That's where I've seen the Caribbean countries and the Red Crosses in them do really incredible work and continue to do incredible work. I mean, this isn't over. And so I see lots of planning underway to continue that work.
Mm-hmm. Right, right. And that's so true. We have to pay homage to the different people all over the world, not just in the Caribbean, but there's so many people, whether the Red Cross, the WHO, there are different organizations that have been doing so much in helping to curb this pandemic and helping to do different activities to see how we can lessen or flatten the curve, right? And it's important for us to learn from each other what works, but it's also important for us to look at focusing on what works for your country, what works for your region, and go with that, because you find that cultures are different, people are different, and so inevitably you have to tailor your responses accordingly. All right. And we've seen in the Caribbean, where, as Angela mentioned, we have used so many different unique ways. For example, in Jamaica, we had the messages on the t-shirts, right? So the same t-shirts that volunteers wear to go out into the field, to give their responses, so to do their different actions, to issue out relief items or sanitation items, hygiene kits, etc. They have those messages on their t-shirts just to remind people that, hey, we're all in this together. Remember to wear your mask and so forth. Remember that we need solidarity, not stigma, to fight COVID-19. So those are some key messages that we really, really want to ensure that we remind people as well. Angela, you wanted to say something?
Yeah, I was going to say, I think the unique, I mean, you were talking about unique challenges, but I don't think it's a challenge. I think when we talk about the uniqueness of the Caribbean, we have 2 music videos. We have 2 artists that have done 2 separate songs around stopping the spread of COVID-19. Like, that is unique and beautiful and wonderful and so incredibly exciting. I think we lost Teresa here. But I mean, that's so incredibly exciting to see that work happening and to see that ongoing support for their countries and for their communities. And that's a really, that music really is unique to the Caribbean. I've not seen anyone else do that.
Yeah, I'm sorry about that. I think I accidentally got kicked off. All right,
No, all right, you're back. I was just going to say, thank you for everyone who is asking questions or making comments. We love it. That's why we're here, and that's why we do this live, is so that if you do have questions or comments, we can get them live.
Yes. And so, and for persons who are asking about the videos, or persons who are wondering about the videos, we actually did have those videos featured on this program as well. So you can look on our channel and look back for that video that Angela was mentioning earlier. All right. So, and Terry's thanking for the response, Angela. We have another question. What are some of the main challenges that you have found among Caribbean national societies, and what do you think is the best way forward to overcoming those? So, Angela, I don't know if you want to take a jab at that. So, the main challenges among some of the
a
national
big question to ask on the fly. I would say the biggest challenge in some ways is also one of the biggest strengths. You have national societies that are very small in a lot of cases. Like, I mean, less than 10 staff members in some of the Caribbean national societies, and the incredible amount of work that has to be done. And I mean, what I have seen and what I think that can continue to be done to overcome that is ongoing recruitment of volunteers and having really great people come forward to be part of the Red Cross movement and give their time or support in other ways. I think that is, I mean, we have as a pillar of what we do, one of our principles is around voluntary service, and seeing that in action makes me realize that will overcome a lot of the challenges that you face as being smaller national societies. I hope that answers it. Kevin, we can maybe have another chat later if there's other ones, but off the top of my head, I would say, I mean, the amount of work working on projects like Zika and dengue and in some cases malaria and COVID-19 and disaster response and disaster preparedness and how you manage all of those projects with grace and including your communities is such a testament to you. But it is a challenge. And like I said, I think volunteers are part of the answer to that.
Yeah, and coming from a national society myself, Angela, and having volunteered with the Jamaica Red Cross for years, I would agree that volunteers play a big role. And if any challenge there is in terms of what national societies face, one of the main challenges is that we need more people to come forward and just volunteer and to give off their service, give off their time, give off their energy, and to help improve the lives of the most vulnerable, to help carry out the mission of the Red Cross, which is to really reach those most vulnerable across the world. And so if you're listening, even as we're about to wrap up, if you're listening, just the Red Cross is an excellent organization to be a part of. So you can find out from the National Society, the Red Cross in your country, how it is that you can sign up to be a volunteer. There's so many different ways that you can volunteer, from helping out in the COVID-19 response to helping with communications. Like Angela said earlier, we got to do a pretty cool activity earlier this year to help make a music video. I've never made a music video before, right? So you don't know what you're going to end up doing, but it's just always so much fun. And at the end of the day, knowing that you're able to make a difference, and knowing that you're able to go to sleep at night knowing that you have impacted someone somewhere, and that is an indescribable feeling, right? So I would agree with Angela that that is something that it's a challenge, but it's also an opportunity. And I would love if persons can if you're listening on this, don't come out of this live without reaching out to your national society, finding out from the Red Cross in your country, how can you be a part of this awesome organization.
And you get to work with some pretty great people. I mean, that's really the take home. That's,
I know, right?
Going back to your question about what I'll sort of take away from all of this. And it's that I've had the absolute privilege of working with so many great people over the past few months. Well, year, it's been, yeah. So join the Red Cross, work with great people like Teresa, and make a difference in your community, for sure.
Right. Is there any final words that you'd like to share with us before we wrap up this live, Angela? You have been tremendous, giving us tremendous support over the past few months, and we really appreciate all that you've done. And as you go on to your next journey, we wish you all the best. But we'd love if you can share any final words for those of us who are listening.
I think we've touched them all, right? Join the Red Cross, be a volunteer if you have the time or the capacity to do it. Wear your mask, make sure it covers your nose and mouth. Wash your hands often, sing happy birthday while you do it to make sure you do a long enough job. Stay physically distant but socially close, right? I mean, be part of your communities in new ways.
Yes.
Thank you.
And remember that we're all in this together as well. All right. And I think that's one of the recurring messages, no matter what challenge we face, because we had COVID-19 and then we have dengue and Zika, and now we have ETA and so many different systems forming even as we speak, right? In fact, next week, we're hoping to speak with one of the national societies. There are so many national societies in the region that have been doing a lot in terms of responding to those who have been impacted by recent hurricanes and storms that have hit the region. You know that ETA had left a severe impact on Central America. Specific countries were targeted, and so the Red Cross, sorry, I say Jamaica Red Cross because I'm from Jamaica. I'm sorry, but the Red Cross in all of these countries have been doing an excellent job. And so we're hoping to highlight some of the work that is being done in some of these countries. How do they respond to a disaster in the midst of COVID-19? Because remember, all of this is new for us. And so how do they respond to ETA, to whatever disaster it is, bearing in mind the context of COVID-19. So we're hoping that we can bring that to you next week. So make sure you tune in. Angela, thank you so much again for joining and for introducing me as the host. And thank you for all that you have done over the past few months. We will miss you. And as we say in the Caribbean, we say see you soon, but you should say soon come back. All right, because we know you're an official Caribbean person now, and you'll definitely be back soon. All right, so
Wonderful.
thanks again,
Thank you.
everyone.
Thank you for joining us. Bye.
Bye.